Hello, everyone. A new report from the UN Human Rights Office delivers a stark and systematic indictment of the assault on Gaza's health system. It documents at least 136 strikes on 27 hospitals, the killing of more than 500 medical professionals, and a pattern of attacks that have pushed Gaza's medical infrastructure to what it describes as the brink of total collapse. The report raises serious concerns about the compliance with international law, suggesting that many of these actions may amount to war crimes and crimes against humanity. It also challenges the justifications offered for the attacks, noting that Israel's claims that hospitals were being used for military purposes are vague and broad. To help unpack the profound implications of this report, we are joined by Na'eem Jeenah, a researcher with deep expertise in the region. This conversation aims to understand not only the scale of the destruction, but also the intent behind it, the legal and human consequences, and what it means for the people of Gaza now and in the future. Na'eem, appreciate your time this afternoon. Now, this UN report is one of the most comprehensive to date on this issue. What, in your view, is the single most important conclusion we should draw from its findings?
Well, the single most important conclusion is that Israel is determined to ethnically cleanse Gaza of its population, and that, as South Africa has argued at the International Court of Justice, what we have seen unfolding over the past 2 years is a genocide that continues to take place. The destruction of infrastructure, the kinds of things you mentioned, medical facilities, but also schools, universities, places of worship, targeting farms, food production companies, electricity generation, water, sanitation, etc. All of that contributes to that understanding, as the report brings out, that what we have seen is a genocide taking place with the objective to completely remove Palestinians from Gaza.
The report states that even if a hospital loses a protected status by being used for military purposes, any attack must still adhere to principles of distinction and proportionality. Now, based on the evidence of complete destruction and mass casualties, does Israel's military seem to have met this legal standard in its operations against hospitals like Al-Shifa and Kamal Adwan?
Absolutely not. I mean, Shifa was probably the kind of the biggest one that the Israelis claimed was a command and control center for Hamas in particular, or Hamas's military wing, that it had a whole base under the hospital, etc. None of that has been proven. And of course, Israel doesn't allow any external investigators to look at it. But from Israel's own so-called evidence, none of it has proven to be true. And initially, that was the kind of justification. And then they dropped that even. The rest of the hospitals that were attacked, they felt that they needed no justification to do it. They attacked hospitals. They killed babies in incubators. I mean, this is not made up. It's has been in the news. They killed patients. They killed doctors. They captured or arrested a whole number of medical personnel, doctors, nurses, etc., who were tortured while in their custody. They destroyed, basically completely destroyed the health system in Gaza, as well as the education system, etc. So none of that is none of that has proven to be true. But as the report says, even if it was true, the response from the Israeli side was way beyond anything that was proportional. Even if it is true that some group is using a hospital as a kind of shield or a base, that does not justify, under international law, the belligerent on the opposite side going into the hospital and capturing medical personnel, killing patients, etc. None of that is justified. But as I said, after the first one or two, Israel didn't even bother making that justification, because as far as they're concerned, they have the right to kill off Palestinians.
Na'eem, we've talked about this report and just how comprehensive it is and covering some absolutely critical issues. Now, what is the strategic and legal impact of this finding by the United Nations?
Well, the issue here, of course, is that as long as Israel remains protected by the United States, and we've seen that in the past 2 years repeatedly in the Security Council, such reports have moral value, they have long-term historical value, and history will judge both Israel and the US and the other enablers of this genocide. But it doesn't have immediate impact, unfortunately. I mean, you take this report together with, for example, the provisional measures issued by the International Court of Justice from January 2024. Various provisional measures, as well as the ruling that was issued in another case, not the South Africa case. In another case, the ruling that was issued by the ICJ. And Israel just refuses to accept and continues doing what it does. And the reason it's able to do that is because it knows that the enforcer of ICJ rulings or opinions is the United Nations Security Council. And at the United Nations Security Council, Israel is completely protected by the United States. Its genocide is protected. The US has used its veto several times in the past 2 years to defeat motions that everyone else, 14 other members of the Security Council supported, and the US vetoed it. So these reports are good, as I say, from a moral and historical perspective, but in ending the genocide that's taking place right now, they have little effect unless the United States takes the right position, and it's not.
So I'm going to draw Ukraine into the conversation, and because Ukraine has received a measure of support from certainly several countries in Europe, whether that support has been material or otherwise, there has been some support. There seems to be very little support for the people of Palestine in the way of getting the world to rally behind this move, and which you describe as genocide. Do you have an understanding of why?
In fact, Hugo, it's the opposite. I mean, European states, the United States, Canada, etc., have not only not supported the Palestinians, the victims of this genocide, and what's happening in Ukraine, of course, no one calls it a genocide, but what is happening in Gaza is a genocide. The UN Human Rights Council has said so as well. The response has been the opposite. The United States, various European states, etc., have been supporting the genocidal power against the victims. So Germany only recently, a few months ago, said that it was going to cease supplying weapons to Israel. Until then, it was the second largest supplier of weapons to Israel, weapons that were used in this genocide. The United States remains the largest supplier of weapons, and a huge part of that is given as military aid. Israel doesn't even have to pay for it. Britain, other states have taken the same kind of position. Not only are they not supporting the victims of the genocide, but supporting those who are perpetrating the genocide. And the question about why is a very good question. In many ways, what Israel represents for various European powers is a piece of Europe in the Middle East. It's a way it's a surviving colony when most other European colonies have been decolonized to some extent or in a post-colonial state. Israel remains a European colony in the Middle East, and they continue supporting that. It's when we say that Germany is the second largest supplier of weapons, and they've restarted now, even though the genocide's not over, second largest supplier of weapons to Israel. Well, what does a genocide mean to a country like Germany, which in the early 20th century committed 2 genocides in Namibia, committed in the middle of the 20th century a genocide or various genocides in Europe? A genocide is what it does. And the same goes for many of the European powers. I mean, think of France and its role in Africa. So what Israel does to the Palestinians is very similar to what they have been doing for centuries. And so they continue to support their own project, in a sense.
Na'eem, final thoughts. The report contains chilling details. A nurse shot while looking out a window, patients found in mass graves with medical equipment still attached, the director of Kamal Adwan Hospital detained and disappeared. What does this pattern of targeting medical staff and patients tell us about the conduct of this conflict? And secondly, let's talk a little bit about the people of Gaza, because whilst we talk about these atrocities, they seem to be forgotten in as far as what sort of life are they living. I mean, the kids, they're going hungry. I mean, all sorts that we can talk about, but you're probably well suited to address these issues.
So on the first point, I mean, clearly the reason for targeting hospitals is to ensure that people who are injured, wounded in the genocide won't receive the kind of treatment necessary for them to recover. And so the attack against hospitals is part of the genocide. It's to ensure that people who are hurt will die. And we saw that in numerous ways. I mean, we saw, that continues also, for example, in children getting struck by sniper bullets, and then anyone that coming to rescue them also getting hit by those same bullets. And we're seeing that not only in Gaza, but also right now in the West Bank, including with children. And the point of it is the genocidal intention is to completely get rid of this population. So, one way of ensuring that is to make sure that people don't get the treatment necessary to recover. But it goes beyond that, of course. So, so that's to do with hospitals. But what about universities and schools? I mean, every single UN school has been hit by Israel, because that's also part of continuing or allowing a population to survive, the ability to receive education and to therefore have the potential to prosper, to live some kind of a life. That also is being destroyed. Same with water, electricity, etc. And so you're finding now a population in Gaza that 90% of the infrastructure has been completely destroyed. 90% of the homes, for example. People are living in tents. Before 7th of October 2023, they were already, because it was 16 years of a siege that Israel had imposed on Gaza, where literally Israelis were counting the amount of calories that were allowed in. Because of the siege, Gaza had to receive 600 aid trucks per day in order to just keep the population alive. Now, after the ceasefire, Israel is allowing in only 200 trucks. 600 before this genocide started. Now, in the midst of the genocide, only 200 being allowed in, when the need is much, much greater, and when Israel has signed an agreement that it will allow in 600. So you can per day. So you can imagine that people are starving. There's malnourishment. There's virtually no health facilities available, and even the 200 trucks that are let in. The other day, there was a truck full of cell phones, not food, but cell phones, and some of the cell phones have started exploding. The food that's being allowed in, UN officials are saying, is not nutritious. So heavy in sugar, heavy in carbs, etc. Again, even the aid that's being allowed in is part of the genocide. And so we're finding children that are malnourished, dying, not receiving treatment. Gaza has the largest number of child amputees in the world out of any conflict. And any conflict you include, for example, World War I or World War II. So the situation is extremely dire. It remains under siege. It remains not receiving the kind of aid that it requires. And another UN report, the UNCTAD report about the economy, predicts that it will take decades for Gaza's infrastructure and life in Gaza to be able to return to anything resembling what it was like in 2023 before this genocide began.
Na'eem Jeenah, researcher at Mistra, speaking to us on the issue on Gaza and calling it a genocide, which the world is standing by and watching.